Now we are moving to the toxicology part. Let's see toxicology part. Okay. So toxicology, it deals with the properties, actions, and lethal dose of toxicity detection or estimation of and treatment of poison is called as toxicology. That is the definition of toxicology. Then what is forensic toxicology? It deals with the medical and legal aspects of harmful effects of chemical on human body is called as forensic toxicology. So it deals with medical and legal aspects. Okay, that's why it is called as forensic toxicology. On chemicals on human body is called as forensic toxicology. Then what is poisons? Any substances, liquid, solid, or gas, which when administered in small quantity into the living body or brought into the contact with any part of it leads to injury or ill health by its constitutional effect or local effect or both is called as a poison. So that is the definition of poison. I repeat, any substance or liquid, solid or gas which when administered in small quantity into the living body or brought into the contact with any part of it leads to injury or ill health by its constitutional effect or local effect or both is called as a poison. So as I said, the definition is not required for us, but to know I have kept it. These acts are very important. Act with ear. You should by heart this acts and ear. So Opium Act, Poisonous Act, Dangerous Drug Act, Drug and Cosmetic Act, Drug and Remedy Act is very important. So Poison Act is 1919. The year is very important. Drug and Cosmetic Act 1940. Drug and Cosmetic Rule 1945. Pharmacy Act 1948. Drug Control Act 1950. The Drug and Magic Remedy Act 1954. The Narcotic Drug and Psychotropic Substance 1985. Prevention of Illicit Traffic and Narcotic Drugs and Psychotropic Substance 1988. I'll give you 2 seconds. You can take a screenshot or you can just go through it and just by heart it. I'll give you 2 seconds. Just read it and fix it in your mind. It's very important. Especially Drug and Cosmetic Rule, Drug and Cosmetic Act. Act is in 1940. Drug and Cosmetic Act is 1940. Drug and Cosmetic Rule is 1945. So it's important. Just take 2 seconds and read it and fix it in your mind. Okay. Then we'll see some characteristics in postmortem findings. In the toxicology part, we are going to see some postmortem features, some characteristics. If the body is deep blue in color, the external feature, first we will study external features, then we will study internal features. If the dead body is deep blue in color, we'll come to know it is an asphyxiant poison or aniline is used. If it is bright red or cherry red in color, it is carbon monoxide or HCN poison. If it is deep cyanosis are there, it is opium and cardiac poisons. Early rigor mortis is occurring strychnine. You should by heart it. Early rigor mortis is seen in strychnine poisons. So it is important MCQ. Early rigor mortis is seen in strychnine poison. Hemorrhagic spots under the skin and mucous membrane is seen in phosphorus poison. Okay, even if there are any hemorrhagic spots under the skin and mucous membrane, it is implied. It gives a clue that it is a case of phosphorus poison. So in the external examination, in the autopsy, we are seeing, we have note down these points for hemorrhagic spots under the skin and mucous membrane. It is in the phosphorus poison. White froth from the mouth and nose is seen in opium poison. White froth from the mouth and nose is seen in opium poison. Blood tinged froth is seen in organophosphorus compound. Blood tinged froth is seen in organophosphorus compound. So these are some characteristic postmortem findings of toxicology. Okay, with these findings, we will come to know, we will get a clue what kind of poison he had taken. Now let's move to the internal findings. So if any blue linings in the gum, it is called as chronic lead poisoning. So blue lines in the gum, the indication the poison is chronic lead poison. Urinary bladder hemorrhage is seen in Abrus rectarius or viper snake or candidary poison. Hardening and whitish discoloration is seen in carbolic acid poison. Sorry, swollen. There is a spelling mistake. This is O. Okay, read it as O. Or loose teeth or fetid smell is seen in acute mercury chloride or chronic phosphorus poisons. So these are some internal findings commonly associated with these poisons. Next, about the preservation of viscera. In the autopsy, how we can preserve the viscera in case of poison. The best preservative is absolute alcohol. So it is important. The best preservative is absolute alcohol and rectified spirit. So this is important MCQ, absolute alcohol and rectified spirit. Alcohol cannot be used in case of alcohol poison, chloroform poison, chloral hydrate poison, formaldehyde and ether poisoning. So these are important. So alcohol cannot be used in alcohol poison, chloroform, chloral hydrate, formaldehyde and ether. And this is also important. More commonly used preservative is saturated solution of common salt. So more common is saturated solution of common salt. Best one is absolute alcohol or rectified spirit. So these both points you should absolute alcohol, and more common is used is saturated solution of common salt. Then gastric lavage is useful within 3 hours of ingestion of poison. The contradiction of emesis and stomach wash in corrosive, convulsive, volatile poison and unconscious poison. Okay, so this is also important. Stomach wash is in contraindicated in which condition? Corrosive, convulsive, volatile and unconscious poison. So emesis and stomach wash is contraindicated in these conditions. So we'll start with corrosive poisons. What is corrosive poisons? How does it act? It will destroy the surface which is contacted with corrosive poison. So that is the first point. It will destroy and erode the surface in contact with the surface. So the sulfuric acid is considered as the strongest corrosive poison. The fatal dose of sulfuric acid is 5 to 10 ml. If it is HNO3, the surface will be yellowish discoloration. In sulfuric acid, it is reddish brown discoloration is seen. Okay. Next, we are going to see what is oxalic acid. It is used as ink remover. So it is important. Which is used as ink remover. This I have seen in some question paper. Ink remover in forgeries. So ink remover in forgeries are oxalic acid. What is the systemic action? Shock, hypocalcemia, renal damage due to tubular nephrosis or necrosis, and cause of death is uremia in 2 to 14 days in oxalic acid poison. What is the antidote of oxalic acid poison? It is calcium gluconate 10% IV at frequent intervals. It's considered as the antidote for oxalic acid poison. So next we are going to study carbolic acid. Okay. So it contracts the pupil. Greenish urine is seen in carbolic acid poison, and this green later will turn into the black carbolism and onchrosis. Okay. Next is metallic poison, non-metallic poison. First is phosphorus. The garlic odor is seen in phosphorus poison. It's important. And luminescent feces and omiters. So luminescent feces and omiters is seen in phosphorus poison. So in the toxicology part, we are much concentrating only where there are MCQ questions are there. This luminescent feces and omiters is very important. Luminescent feces and omiters are seen in phosphorus poison. Third degree burns are also seen in phosphorus poison. antidote of phosphorus poison is copper sulfate. So it will form a copper phosphatase, which is harmless. Symptom-free period is 2 to 3 days before systemic toxicity. Hemorrhage due to blood vessel and inhibition of blood clotting. The chronic poison is called as Forcijo. The chronic poison, the Forcijo is seen, and it is also called as Diwali poisons because it is seen in much amount in the crackers as seen in season of Diwali. In the crackers, the phosphorus is present. That's why it is called as Diwali poison. Next is organic irritant poisons. So in the organic irritant poisons, first important is resinous communis. The resinous communis, the toxic part is resin. The whole plant is poisonous, but more common, the seed is more poisonous. The poisonous part is in the resinous poison is resin. Okay. Okay. So one thing I forgot to explain, that is here. Ochronosis. The ochronosis is nothing but it means the blackish pigmentation in the urine, the skin. In the case of carbolic acid poison, there will be a blackish pigmentation, or the urine will turn into black. That's why it is called as ochronosis. Okay. Okay. So the toxic part of resinous communicase is resin. The croton-tick, it is crotin and protonoside. In abrus bacillus, it is abrin and abrain and abralin. So it resembles viper snake poison. So which poison is resembles the viper snake poisoning? It is abrus precatorius, and is also called as cattle poison or stew. And the ergot, the poison part is or poison content is ergotine, ergotamine, and ergotometrine. And semicarpus anacardium, it is semicarpal and bilvanol. It is produced artificial bruises. So it is also important. Which is produces artificial bruises, semicarpus anacardium, marking nut. Next is calotropis. It's also called as arrow poison, produce artificial bruises. Next, we are moving to the metallic poison. The metallic poison, first we are going to deal with arsenic. So, metallic arsenic is non-poisonous. It resembles gastrointestinal disturbances. The antidote for arsenic is freshly prepared ferric oxide. Is the antidote for arsenic poison. In chronic, it will go to raindrop pigmentation. The raindrop pigmentation is seen in arsenic poison. It also causes hyperkeratosis. Aldrich measlines, it's important. Aldrich measlines are seen in arsenic poison. Red velvety appearance of stomach mucous membrane is also seen in arsenic poison. The test for detection, you should know what is the name of the test. No need of explaining what are the tests, but test for detection of arsenic poison is Marsh test and Greenwich test. Okay. Next we are going to mercury poison. It is mercury chloride. Okay. So it will cause us chronic mercury poison will cause us shaky pulsing, mercurial erythism, mercurialis salivation, blue lines in the gum, sore mouth and throat, sore mouth and throat, and anemia as characteristics of mercury poison. Next, lead poison, plumbism. Okay, acute metallic taste, dry throat, peripheral circulatory collapse, depressions, coma, and death is seen in acute poisons. Okay, in the chronic case, it is facial pallor, anemia, and lead light, similar in case of mercury, cuprum, bismuth, ferrum, etc. And abdominal colic and constipations are seen. Lead palsy will be there. Lead encephalopathy is more common in children. menstrual irregularity, sterility, renal dysfunctions are the other symptoms of lead poison. So fatal period of lead poison is 1 to 2 days. Cerebral attacks is more common in children in case of acute poison. The lab it will show porphyrinuria. It is the lab finding seen in lead poison. It is porphyria. And the chronic lead poison is plumbism. Next we are going to the copper. So copper is bluish green powders, or it is present in bluish green mass also. The fatal period of copper is 1 to 3 days. Gastric mucosa or stomach is greenish and bluish. The chronic copper poison is Wilson's disease. Next, we are moving to the somniferous poisons. So we are covering only the important MCQ parts in toxicology. We are not covering like our forensic part. We are covering what are the most important topics as we consider to the toxicology part. Okay. So opium, it is two kind. Poisonous part is morphine, 10%, and sedin and thebaine. It is papaverine narcotin. It is similar to endotrophin. So it is similar to endotrophin. It causes 3 stages. First is stage of excitement, followed by stage of stupor, and followed by stage of coma. Pinpoint pupils are seen. Do not react to light and bradycardia. Then it is especially seen in striatus breathing. And the treatment is important. About the treatment, it is thin hydrochloride. So this is important. Absolute alcohol is 99.95%. This we have studied in pharmacy. And rectified spirit is 90%. Proof spirit. Sorry, there is a mistake in this. Okay, we correct it. In rum, it is 50 to 60%. In brandy, 40 to 45% of alcohol content. In the wine, 10 to 15% of alcohol content. Absorption, 10% through the small intestine and 20% through the stomach. It has got the first stage of intoxication, sorry, stage of excitement, stage of incoordination, stage of coma. These are the stages in ethyl alcohol poisoning. Stage of excitement, stage of incoordination, and stage of coma. Okay. Then one more important point is intoxication. The blood alcohol concentration is 80 to 100 mg, then it is considered as legal intoxication. Okay. So in the we have seen in the polices, they will be catching those who are driving with after drinking alcohol, and they will be testing the blood alcohol content. The blood alcohol concentration, if it's more than 80 to 100 mg per deciliter, it is considered as legal intoxication. So what is the treatment of ethyl alcohol poisoning? That is hemodialysis and peritoneal dialysis. The dialysis is the treatment option for ethyl alcohol poison. Okay. Then antabuse inhibits aldehyde and dehydrogenase. Then let's see what is drunkenness. It is responsible for crime committed in voluntary. Below 10 mg, it is called as sober. 20 to 70 mg, it is drinking. 80 to 100 mg, that we have discussed here also. The 80 to 100 mg under the influence, and 50 to 100 mg, it is considered as drunk. Above 400 mg, it will percentage, it will cause to coma and death. Okay, now let's see about datura. The poison content is hyoscine, it is 0.2 to 1.5, and hyoscyamine and atropine. The common symptoms of datura poison is fever, dry mouth, throat, dysphagia, widely non-reacting dilated pupils. So it is important. Widely non-reacting dilated pupils are seen in datura poison. Photophobia, diplopia, restlessness, and delirium. These are the symptoms of Datura poison. And the treatment is physostigmine, phylocarpine nitrate. These are the treatment for Datura poison. And the test is name of the test is important. Mydriatic test. Pupils will dilate within half an hour if Datura is present. So that test name is important. And the run amok next is cannabis sativa. Okay. In that chronic poison is run amok. So run amok, the name is important. Run amok is seen in cannabis sativa poison. Then food poisons, food poisoning, bacterial food poisoning, botulism. Okay. Infectious type mainly Shigella, Salmonella, coli, and Proteus streptococcus are present. And toxic type due to performed toxins. The incubation period of Staphylococcus is fatal period is 1 to 6 hours. And botulism, no signs of gastroenteritis, no diarrhea, and Clostridium botulinum is causing it. And differential diagnosis is tetanus, epilepsy, and acute gastroenteritis. Okay, that is very important. Then we moving to the spinal poisons. First is naxomekia. It is causing postsynaptic block. Strychnine is 80% and brucine is 20%. It resembles tetanus poison. Anterior horn cells are affected. Convulsions affect all the muscles at a time. So here in the naxomekia poison, convulsions are occurring. Convulsions are occurring in all the muscles. At the same time, the whole muscles will be getting convulsions. And consciousness is not lost. In between contraction, muscles are relaxed. Okay. And the treatment is important. Short-acting barbiturate, diazepam, stomach wash with pot of permanganate is important. These are the treatment for that. And brain to be preserved in case of naxomekia poison. And postmortem caloricity. What is postmortem caloricity? I hope you all are remembering what is postmortem caloricity. We have studied some graph like this, and initial rise of temperature followed by algaramotis or fall of temperature. Okay. Okay, next we will study about cardiac poisons. It is hydrocyanate poison. We will study so odor like a bitter almonds. It's seen in hydrocyanate poison. So these are important points in cardiac poison, hydrocyanate poison, and the treatment is also very important. The treatment is amyl nitrate inhalation. The treatment for hydrocyanic acid is amyl nitrate inhalation. Okay, bright red postmortem stains due to carboxyhemoglobin. So this is also important. Okay, then death is due to cytotoxic or histotoxic anoxia. So what is happening? It inhibits the cytochrome oxidase and carbonic anhydrase. Okay, so that's about the cardiac poisons. Then the last one is snake poisons. So we'll discuss snake poisons. Basically, there are 5 families. One is protidale, viperide, elpide, and hydrophyte, and colbride. So all those examples are also important. First is pig pepper, rattlesnake, saw-scaled viper. For the second, viperide, Russell's viper, saw-scaled viper, and elapide, cobra, KRAIT, sea snake. All those examples are also important. But in India, there are 5 dangerous snakes are identified. The 5 dangerous snakes in India. One is king cobra, second is cobra, third is common KRAIT, next is Russell's viper, and saw-scaled viper. These are the 5 common or dangerous snakes in India. Okay. Sorry, 1 second. Okay, so these are the 5 common snakes in India. So the snake venoms we are classified bales. First is neurotoxic. The snake can do the neurotoxic, hemotoxic, and myotoxic. These are the basic 3 classification of snake venom. So we have seen there are basically 5 dangerous snakes, and there are 3 types of snake venoms. What are the 3 types? One is neurotoxic, second is hemotoxic, and third is myotoxic. In the neurotoxic, the death is occurring due to the respiratory paralysis. So the neurotoxic, the death is due to respiratory paralysis. In hemotoxic, what is happening? It occurs the disintegrated coagulations and depressions of the coagulation. And next is muscular tissues, that is myotoxic. So these are the 3 different ranges of snake venom. So cobra, so this just to it is a cobra poison is a neurotoxic. Okay, so it can be asked cobra poison is a neurotoxic, and it will causes weakness of the muscles and paralysis. So because it will act on the weakness of it will produce weakness in the muscles and paralysis. So in the reddish wheal at the site of bite is seen in cobra poison. Okay. Common KRAIT. These all are the common names which is seen in, which is for common KRAIT. It's not important, but just for a knowledge or just for information, I have kept these names. And it is a neurotoxic. This is an image of common KRAIT. Okay. Again, okay, these are the common names. Sorry, these are the common names, and it prefer the plains and found throughout the India. Russell viper. Okay, Russell vipers. These are the common names. It found throughout the India. Then snake venom. Highly concentrated, clear amber colored digestive juice on drying forms fine needle-like crystals soluble in water. The toxic properties are due to this. Okay, this is 3 are important. The toxic properties in snake venoms are due to proteolytic enzymes, phosphatidase, and neurotoxins. The toxic properties are due to these enzymes: proteolytic enzyme, phosphatidase, and neurotoxins. Then the symptoms. It is classified into, first is mild and local symptoms are burning, redness, swelling, superficial necrosis, and mild neurotoxic. The earliest symptoms is ptosis. This is important. The earliest symptom is ptosis. And giddiness, lethargy, muscle weakness, spreading paralysis, causing difficulty in speaking and breathing. So the spreading paralysis will lead to difficulty in speaking and breathing, salivation, vomiting, frothing around the mouth. Okay, so the treatment I have given more important because we all are doctors, so we should know what is the first aid in the snake poison. Other than attending an MCQ exam, we should able to handle, at least we should able to give the first aid in case of a snake poison. So I have added the treatment part also than a MCQ point. As a practitioner, we should know what are the basic things we can do. So allaying the fear and anxiety, and some measurements to prevent the spread of inner, and of course use of antivenin and other antitoxic therapy and general measures are the first line of treatment. So this is very important. Tourniquet, it should apply only on the limbs. In the other parts, you should apply firm pressure. Applied 5 centimeter proximal to the bite part. Some people we have seen they will be tying with tight rope and they won't allow the blood to pass, and it will process because of tying of this rope or tying of the material. It will lead the other complications. Okay, so it should be very careful that tight enough to occlude superficial veins and drainage of lymphatic, should not impede arterial or deep venous flow. So this you can see an image diagram below. Because the longer use of the tourniquets or longer pressure, which will lead to necrosis. Okay, so you should release in every half an hour, every 15 minutes for 30 seconds, allow small quantity to escape into circulation and to be destroyed. Applied for 2 hours, longer use aggregate the tissue damages. And about the antivenom, the antivenoms are basically classified into 2: specific antivenom and polyvalent. Specific antivenom means to a particular snake, a particular venom. But many of the time, the papers will not able to identify which snake have bite them. So it's very difficult to give a specified antivenom. So that's why we are using the polyvalent. So it is useful in case of cobra, it is useful in case of common krait, it is useful in case of Russell viper and saw scale viper. So that is called as polyvalent. So these are the two types of antivenoms. Okay, by this I think we can conclude the FMD part. So we have discussed from introduction to toxicology,